Good morning, everyone. Thank you for joining us here on Chai Time. Today we have Dr. Umer Virk here at the studio, and we are going to dive deep into understanding dementia and learn ways to navigate caring for a loved one with dementia in a less stressful and more positive environment. Good morning, Doctor. How are you doing?
Thank you, Ms. Lynn. Thank you for having me. I'm doing really well.
Yes, so today we will be talking about dementia, having a better understanding, not only for the patient, but also for the caregivers, which is so important. But before we dive into everything, let's just start with a brief introduction of yourself.
Yes, thank you. Yes, my name is Umer Virk, just like Ms. Lynn said. I am a clinical faculty at Baylor College of Medicine. I am also working at Ibn Sina, helping them to integrate the mental health and family medicine program together. My background in, mainly in mental health, but I do deal with a lot of dementia and mental health. They come together, and I am here today to hopefully we can dig deep into and help our audience and people to help their loved one better.
Yes, it's we've been doing Chai Time Show for almost 7 years now, and we have never touched on this topic. So, it's like just off air when we were talking, there's so much about dementia. It's not just that one thing. So we are kind of just going to we cannot dive deep into it and go into, because we'll need more than an hour for sure. But so let's begin with what is dementia and how is one diagnosed?
Yes, so you're right. To talk about dementia, we can talk for days, and probably we'll still not have enough time. We will try to go briefly. So, first of all, dementia, a lot of people believe it's just a loss of memory.
Yeah.
That's not true. Loss of memory is just one component of dementia. Dementia is, when you have hard time to make decisions. Dementia is when you have a social interaction issues, decision-making issues, and then, of course, the main thing is memory. When your memory is not in the background, you have all those symptoms.
Correct.
So that's what dementia is. And before we dig deep into it, there are a lot of misconceptions about dementia. Right. A lot of people believe it's a normal part of aging, but that's not true.
Okay.
Not everybody who gets older, even 100 years, no, they don't have dementia.
Okay.
Dementia is a disease process that some people have it, some don't. Even very elderly population, 90s, people in 80s, they do retain their memory intact. Okay. They do have decision-making power. They still, think clearly. They can learn. But if they have dementia, then these things are impacted. So not everybody who's older have dementia. It's a disease process just like any other disease.
Okay, that's good to know. And so what are the early signs of dementia?
Yeah, so there are multiple ways to find out somebody have dementia. Of course, we talk about memory, but the things you need to keep an eye, if somebody is getting lost in familiar neighborhoods, like if they drive on the same path every day and then out of nowhere, they just lost somewhere.
Correct.
That's one symptom, right? Using unusual words to refer to something that is familiar, right? They use words similar they were using in the past because they were not able to find the words to express those objects, right? Forgetting old memories sometime. You ask them some question and they're like, oh, we don't know, or, they don't have any information. Not able to complete some task independently, asking some help. Like small things, small clues you start noticing, right? Sometimes, they're pacing up and down in the hallway. They look lost. You ask them what's going on and they're like, oh, we don't know. These small clues. And then sometimes, they forget a certain object name, and then they remember later on.
Okay.
So these are all symptoms of dementia, early signs that you can detect.
So is that when we should be concerned to take, consult with a doctor if we see, or is it just, say if, one of my parents, one of the signs that you mentioned goes through that, but only the one time or maybe twice during that, that episode, right? Goes through this episode. So do you think as, I should be concerned with that and, consult with the doctor, or should I just put it on my journal or keep it in mind?
Yes. So as far as, that's a good question when you're going to see a doctor. I think you should see a doctor when you reach the point where these activities or these behaviors start impacting your social life. Okay. If it's a once in a while, I'm sure even young people sometimes do forget about age.
More than seniors.
So it should not really cause a concern. But if you can put everything together, for example, this person is 65, something older.
Okay.
They are having those symptoms, and they are causing to the point where they may impair their safety. Like, for example, somebody losing in their familiar situations, or they are not stopping on a stop sign because so then yes, you should see somebody, a professional, and try to help diagnose.
Correct.
But if it's a once in a while and it's not really impacting, I don't think so. It's really 100% necessary to see a provider or doctor right there.
Okay, but just kind of be aware of it.
Be aware of that, because then that's where it starts, and then over time it do get worse, and then these patterns and these behaviors can get worse.
Correct.
You will see changes in their behavior. They get maybe a little bit more angry.
Okay.
They sometimes they argue, and not reasonable. So because eventually the decline continues.
Oh, okay. So how common is dementia?
Dementia is actually very common, and in last few years, it actually in American population it has been going up. A lot of more patients are being diagnosed and being treated for. And now there can be two different reasons behind it. One is because people are more aware. They're going to doctors. They're going to care for themselves more often.
Yeah.
And second thing is it's just a little bit on the rise because we have more aging population. People are living longer. If you look 40, 50 years back, for some reason, medicine was not advanced. People used to die a little early.
Correct.
So now, and dementia is mostly old age disease normally. It can happen in young people, but it's mainly an old age disease. So people live longer, you see more dementia patients. It's pretty common. I think I was reading a research. There are, at this time, there are 4 or 5 million American above 65 who have dementia, even more than that.
Oh, wow.
Yeah, so there are a lot of population over there.
Oh, okay. It's, doctors, it's so, I don't know, it's like in the U.S. there's so much of research done, so much of data, statistics that we get the numbers, but when we, in India or Pakistan, Bangladesh, there are not many, dementia is not really talked about or even known, right? There's not much awareness to that. So I guess sometimes people say people living in those countries, the seniors are healthier maybe, or, do you think that is some facts to it, or?
Well, I don't think so. We really can broadly classify. If you ask me one question, the average life expectancy overall in America is high. Before COVID, it was 80 something. I know it's a little bit down now, but COVID was a big component. In India or Pakistan or even Bangladesh, I'm not sure either Bangladesh, but India or Pakistan, life expectancy is in 60s basically. We have 65 in average life. So do we really can compare it?
Yeah.
Yes. As far as you can talk about healthy lifestyle, and yes, maybe they're a little bit more active than us, and that's a healthy thing, right?
Yes.
But we can also talk about the food. Do they have good enough food or more natural food? So yeah, these things are relevant. I understand, but I don't know if we really can generalize that people over there are less likely to have dementia than here. It's a lot of multiple factors, as I mentioned: age, food, healthy lifestyle, activity, and all that stuff.
Okay. So what do the stages of dementia look like?
Yeah, just like I mentioned earlier, with the sign and symptoms, it do develop over time. For example, in some people, and also it depends upon types of dementia, what type of symptoms you're going to have, right? Sometimes it just starts with the subtle things, start forgetting things, right? And then over time they get angry, the behavioral problem comes. Sometimes they start having hallucinations, they are talking to themselves, or they're talking to people who are not in the room. So over time it keeps progressing in different stages, and there is also no strict timeline. It's not. It does not mean if you have dementia for 2 years, you're going to be already in this stage. Every humans have a different timeline to display those symptoms. And sometimes symptoms are very specific. There's only one symptom, and you don't see a lot of other symptoms around them. That's basically, how we just have to keep an eye. The progress is different.
Okay.
There's no 100% concrete stages per se.
Okay. And even earlier we were talking about types. I was telling you I was reading an article on dementia, and I was so shocked that there are actually different types of dementia, which I wasn't even aware. I thought dementia was just on its own, and then you mentioned Alzheimer's, right?
Yeah.
So maybe we can elaborate on some of the different types of dementia.
Yes. So yes, dementia has a lot of types. Yes, that's true. Alzheimer is more well known because it's most common. A lot of people who get dementia, 60 to 70% have Alzheimer dementia.
Okay.
The remaining types are less, common, and some. So yes, there like Alzheimer is one most common one. There are frontotemporal dementia. There is a vascular dementia. Vascular dementia is more like a mini strokes. When people have small stroke and they damage a certain part of your brain, if they damage the parts that affect memory, you are going to have dementia, right? There are nutritional dementia. For example, people who drink a lot of alcohol. It's called Korsakoff dementia. In this case, when you drink too much alcohol, you lose a vitamin B1 that's called thiamine. It's more common in alcoholic patients, right? And the body don't absorb too much vitamins from the diet because with the patient who have drink alcohol, their stomach is not absorbing those nutrients very well, and eventually with that deficiency, they have started developing dementia. We see a lot of patients who don't come to doctor regularly and drink a lot of alcohol. They start developing those memory symptoms. So that's nutritional dementia here. So vascular dementia, as I said, there is one very interesting dementia called dementia of Lewy body. In that dementia, actually the first few of the early signs are actually hallucination. People start hearing voices or talking to people that are not there, and that's the first sign. So that's another type of dementia. They all have one thing in common. Most of them have common the memory issue, but the other symptoms are variable.
Wow.
Right? And there are mixed dementias too. Like mixed dementia means you can have Alzheimer and vascular dementia together. The 2-3 different. So it's very complicated, and sometimes even diagnosing them is a little harder. So we go to the extent like do multiple testing, blood testing, brain scans to identify, okay, is it just the Alzheimer or there is something in combination going on, right? Then vitamin B12, that's very common actually. Right now, I do see a lot of deficiency in my patient for vitamin B12. Deficiency of that vitamin for long enough time can cause dementia, and that's preventable actually, right? If you check your vitamin B12 and if it's low, just get supplements and that'll be fine. And there's one more very interesting that's more genetic dementia, the Huntington disease. In Huntington disease, it actually started very early, in 40s, 30s sometime, very young people. Whenever you see a very young person with the dementia, having hand movements abnormal, shaking your head abnormally, think about Huntington, and that's genetic. It's normally inherited from the parents. Normally people have families who have them, or sometimes if they lost their family very early on, they've never seen them have those dementia, and now they have in 30s out of nowhere, right?
Yeah.
So yes, so there are many other types. There's a normal pressure hydrocephalus in dementia.
That's such a tongue twister.
Yes, and in that dementia, it's actually very interesting the way it works. Just in our brain, around our brain, there is a lot of water. It's called cerebrospinal fluid.
Okay.
The brain is not just pack in the head. There's a lot of fluid to keep it safe. In those cases, your body produces too much of that fluid, and that eventually leads to dementia symptoms.
Wow.
So yeah, so there are more. I can keep going on that.
This is so fascinating. Like the brain itself is so fascinating, right? The organ, like it's just everything is connected to your brain, and sometimes we don't even realize that, right? Like, so it's there's so many things. Like even when we learned in biology class, when we were learning about the brain, it was just learning so much about it. Like you see when we see, we're saying, wow, it's connected to your vision, your hearing, your thinking, and all of that's also, even your emotions.
Yeah.
Everything is connected.
Yeah, that's a great point, and I think that's one of the reasons brain is less understood per se, because it's so complicated and it's linked to so many things. It controls basically the whole body system. And you mentioned just some generalized, but even it controls some level of blood pressure. It controls your heart rate. It controls your, vision you mentioned about it. It has everything to do. It's basically the head of the body. If it's working well, everything is good.
Yeah.
And it's less understood in a sense because a lot of part of brain do work dual functions, more than 2-3 functions. So it's less understood in that sense. Like, for example, if certain part of brain is helping you with memory or learning, it's also helping with emotion sometimes. It's also helping with long-term memories. It's also helping with some of the executive decision making. So whenever some certain part is impacted, it might have multiple system problems.
Correct. Yeah. And so we do know that there is no cure for dementia as yet, at least. So what are some preventative measures that one can take?
Yeah. So right now you're right. Like a lot of dementias are not really reversible per se. There are a lot of we can go one by one. For example, if you say preventive, right? What can prevent from having dementia? There are certain factors who are modifiable. Certain you cannot really control them, right? For example, non-controlling one is your age. Yeah, nobody can reverse the age, hopefully. And then or genetics. Once you're born, you already have your genetic makeup. You cannot do much about it, right? If you're lucky, you won a jackpot on lottery on your genetics, good, right?
Yeah.
But if you're not lucky enough, sure, we don't do. So, and then there are modifiable risk factors. Like, for example, I mentioned earlier, alcohol. If you can lower the use minimum, if ideally no, but you can lower it lower, right? You can eat healthy, keep an eye on the vitamins, check your diet, exercise, very important. Why? Because it improves the blood circulation in the brain, and that's very, very helpful for long-term, your better memory. You have to get out, get fresh air, walk, put the blood flow in your brain increase, right?
Yeah.
So other factor that can, impact it, smoking. No smoking, please. That can impact your memory long term. So these are all preventable. Food, diet, exercise, smoking, alcohol, healthy life choices. Just eat healthy, eat less processed food, that your body can process. Eat more like natural. So these are all preventable factors up till this point that we kind of know.
Okay.
Control blood pressure, it's very important. Control your blood pressure. If it's too high, that can also cause the problem in the memory. So keep it in a very good range where it's recommended. If it's too low, that can still cause some problem because your blood flow not flowing enough in the brain. If it's going too high, that's a problematic too.
We don't realize that because when we talk about blood pressure, it's mostly related to our heart, right? Not really to...
Yes, but I will go a little bit science, right? What the heart does, it just pumps blood everywhere in the body, right? And why everywhere in the body, we need blood? Because it carries oxygen.
Yes.
And oxygen is very, very vital for every cell in the body. If you are having low blood flow, for example, like you are having hypotension, your brain is going to less oxygen flow. So that's going to impact your brain cells. It's called neurons, right? And so yes, blood flow is important. It's all relevant. Yes, it is mainly heart related, but heart is itself is just an organ, but the job is supplying blood, and we have to supply blood evenly everywhere.
Yeah, that makes sense. So, doctor, I wanted to talk about, like you were talking about exercise, right?
Yeah.
And now you were just mentioning about exercise, which is more physical exercise that you talked about.
Yeah.
What are some mental, like exercise too, like activities which would be good for dementia patients?
Yes. So, of course, physical exercise is important, but in mental, to keep it sharp, it's important to do puzzles, do the card games, to keep your brain running, like putting words together. There are words game out there. There are a lot of them. You kind of play the cards with the family, with your loved ones, and keep your brain sharp. I'm not a big fan of online gaming, but I'm sure some online memory games will help too, because to keep your brain running. Because basically, say brain is circuit. It's cells need to keep connected to each other and keep functioning well. Right.
Right.
When I was talking about the mechanism of dementia, the main definition is when your brain cells are not communicating with each other. That's a dementia. So we need to exercise them physically and mentally and emotionally to the point where they stay connected with each other and they keep communicating with each other. And then, it become the card games, puzzles, and all this stuff will be helpful.
And also, do you think we should include having the conversations, like communicating a lot, talking about old times, with our parents, bringing back old memories, things like that, so that kind of like...
Exactly. That's what the point is, right?
Yeah.
Because that part of the brain is that control emotions that need to communicate too. If you're playing game or puzzle or card, maybe emotional component is not as dominant.
Correct.
In that case, the conversation with them, sit with them, talk to them some old times, just kind of bring it back, old memories, and maybe that brain's neurons can keep functioning and interacting with each other and hoping they will keep alive.
Yeah.
If you don't use a certain circuit, they might stop working eventually, right? They might
Right.
start,
Right.
So don't let them rust.
Yeah. That's the main point. Yeah, because I'm thinking, like, even when my dad was alive, he had Parkinson, and I remember he had gone downhill, like gradually going downhill quite a bit, to a point where he was not able to walk, to move. None of his, like, he could not do his daily thing as just simple as even sitting or swallowing. It was very, very difficult. But I think when he started going into rehab and they got him into gardening, or they, like you said, play card games and all for dementia patients, but even with Parkinson, I remember my brother playing this game. It's like a Chinese card game. It's called Mahjong. So, his brain started kind of like working and thinking, okay, I need to make these into sequence. I need to make these into, group them together. So those things, I feel like it's so important. Even like gardening he loved gardening a lot. So that was his passion, I think, and that changed because it seemed like a miracle to us for a man who just could not walk or could not even like eat his meals. It had to be more liquid, into liquid form. But he was able to swallow, he was able to chew. It just reversed things a lot for him. It took a while, but it still did. But of course, he didn't become his normal self. But at least he was able to walk with a walker. He was able to do a lot more other stuff. So what you're saying is true, and it's like truly heartbreaking sometimes for us family members to kind of see that, right? Because for us, like for me, my father was the strong figure. He was the one who worked day in, day out, provided, the meals and education and everything. And then at that stage to see him was totally heartbreaking.
Yeah.
So
no, I totally agree with that. To see your loved ones, that were head of household, that was running the show at one point in your life, and then you're basically caring for their basic needs, like trying to feed them, or trying to bathe them, or trying to help them with the bathroom. It's a heartbreaking for any family, to be very honest. And that's why dementia is so important, and to understand how it impacts the families, because that one person is going through their own pain, or maybe they were not even processing that information as correctly due to dementia.
Correct.
But everybody around them is really bad pain. I will not use the word miserable, but I'm sure that's what it is, right?
Correct.
And yes, going back to the point, when we put these people, in programs or rehabs, and they help them certainly to slow the progression and bring some functionality back, than just keeping them in the room or not letting them do anything. So these are things are important. So we can try to at least get help, and if it works, great, right? Because at the end, it's all about quality of life. It's not about quantity, in my opinion. It's a quality.
Correct.
Whatever year you have to live in quality and good environment, and that's why it's important to get help. Get help for them, get help for yourself. Because everybody is going through that same problem, right?
Yes. And even and in our community, right, specifically in the South Asian community, there's so many things that are such a big stigma in our community. We don't even talk about it, or we are not aware about it. So I think it is important, and I'm glad that we are touching on this, because things that we are not aware of, we just kind of it's very confusing. So to have clarity and to that's important. And I think the most important thing is to talk about it, to be able to ask those questions to our providers, to our doctors, and things like that. Because I feel even now at this point, when we go to the doctor, many times, and especially when it comes to our seniors, they feel like, I don't want to waste a doctor's time because it's precious, and I don't want to ask too many questions.
No,
so.
I think you're right, and especially that's more common in Asian community. We do feel like we should not ask too much question. It's disrespectful, or it's going to waste somebody's time. No. There's no question is a bad question. I think you should consult your doctor. You should ask them what to do, and they have responsibility to answer you. That's why we are sitting there, right?
Correct.
Yeah, that's the only job we have.
Correct.
Yeah, to make community aware and help them out in the hard times if we have ability, right?
Correct.
But anyways, coming back to stigma, yes, unfortunately, even with the education, with a lot of awareness, we still are struggling with a lot of stigma in Asian, in specifically Indian, Pakistani, Bangladeshi community, and even in Chinese. I mean, a lot of population. I have a lot of Chinese patients actually, Asian communities, Vietnamese, a lot of. Because we kind of feel like, oh, that's just normal process of age, and they're just old and they're gonna feel that way. No, that it need to be talked about, and maybe there are some reversible potential, right? And same for mental health. That is very closely aligned with the dementia. It's just overlooked. I mean, I can even count some of my patients on my fingers, how many I have from Asia.
Oh, wow.
Most of the population who is actually getting help is a Caucasian, white American population. Now, it is getting a little better. I'm not saying it's all bad, but we are still struggling to get that community, the Asian community, in the mental health arena, and trying to ask them, okay, it's as simple as a high blood pressure. If you have a high blood pressure, what are you going to do? You're going to take some medication. And same for anxiety or depression or any other problem, right?
Yes.
We need to talk about it, and it may be helped. No, you are not crazy. You know what that the word we use, oh, are you crazy? No, we are not crazy. You just have anxiety or you just have depression, and that's it. And we just need to talk about it, and there are a lot of options out there that we can help. So yes, Asian community is lacking behind on a lot of department in that region, and we need to work on it.
All right, so let's just go on a short break, and when we return, we will continue our conversation with Dr. Virk. This is Chai Time on 103.5 Hum FM. Welcome back to Chai Time on 103.5 Hum FM. I am in conversation with Dr. Virk, and the topic of the day is dementia. We have covered so much, and there's so much more to cover as well. So we are going to continue our conversation. Doctor, we are going to kind of cover a little bit on the medical side of it. So can you give us some of the treatment options and the diagnosis as well?
Yeah, so diagnosis depend upon, also there are multiple things we do to narrow down what type of dementia is there. Just like I mentioned earlier, the CT scan is pretty popular, MRI, when we scan the brain, it can show us certain features of brain. For example, some people have brain shrinkage. In Alzheimer's, the brain kind of shrink a little bit, right? So, and we have different type of proteins accumulating in the brain. It's called tangles.
Okay.
So that help us to understand, diagnose the Alzheimer's dementia. And that actually they also keep doing the scan after, years after years, or in a rapid succession, to keep monitoring the progression of the disease, right? Other testing, there are some blood tests out there too, actually. Recently got approved, I think a couple of years ago, that can take a blood sample from you and can look some protein in your blood and tell you if you have more likely to have chances of Alzheimer's. There are some tests where they take a sample from your brain fluid, like cerebrospinal fluid, the fluid I talked earlier.
Yes.
There is a fluid, so they can take that sample out and also analyze it and tell us if there is a certain type of dementia is there, or it's going to happen in there. Other tests also, blood tests as mentioned earlier, if it's a nutritional dementia, vitamin B1 can be detected, vitamin B12 can be checked. So blood tests are there. So yeah, there's a combination of radiology, scannings, and blood tests that can help us to narrow down the dementia. As far as the treatment goes, first of all, just like we talked earlier, there's no cure as such. It's more like a preventive or slow the progression. There are different classes of medication that we use to help people with the dementia. Some of the most common, drugs class that we use are, cholinergic drugs, cholinesterase inhibitors. Some other drugs are like, especially for if patient has some anger or some behavioral issue going on, we give them atypical antipsychotic. The same drugs we use for schizophrenia or bipolar. We sometimes help them to, attain their, mood and help them with the mood process. So these are few treatment options, but I feel like there is still a lot of research need to be done, and there is a lot of more room for research to help people with dementia. I feel like we are not doing enough job. Well, there's a lot of research going on, right? There are other medicine that NMDA antagonists, and these are a few options.
Okay. And how can we support a family member with dementia?
Yeah, that's very important. I think that's probably the most important aspect of dementia, because it impacts the whole family. It impacts the whole situation in home. So there are many ways to support a family member. There are two ways. First of all, support yourself, and then also support your family member, right? Let's talk about, supporting the family member who has dementia. First of all, the rule: don't argue with them. Don't try to tell them you have a dementia and you forget about it. Don't tell that. Just listen to them and try to still reason them. Sometimes the reason they are upset are very valid reason. For example, if they put something and they are not able to find, even though it is due to dementia, but that's a valid reason to be worried. I mean, if you place something and you forget about it, I'm sure you can get a little bit, mad or angry or something, right?
Yes.
So sometimes these emotions, so the bottom line is let them express their emotion and try to be engaged with them. Tell them, hey, what's going on? How can I help you? Why it's bothering you? What's going on? Just be, there to help them, right? You can help them to keep reminder, keep a diary, so they can write their appointments. To keep an alarm on your phone or at home, what time they need to take medication. Because they're going to start forgetting the medication, they're going to start forgetting the appointments. So try to be ahead one step and try to facilitate them so their lifestyle does not really become impaired, right? If you have ability to drive to take them to appointments, great, that will be helpful too, right? So you can help them in that ways. When you are dressing them or bathing them, don't treat them like a baby. Just let them put the shirt on. If they feel like at some point they are stuck, go ahead and help them out. Don't try to take over the whole responsibility. Yeah, we do that.
We do that
even though
so
we feel
much.
like it's respectful, but no. Let them, because they were independent
Yes.
before that, right? So you're trying to, target that, because even their emotions are impaired, but that can impact them negatively.
Yes, the
Right?
health becomes a hindrance.
Right?
Yeah.
On other aspect, you can get some loose clothing. I mean, you don't have to, so they can wear them easily. You can be more mindful if you can get a, shirt labeled loose, so they can fit on them really well.
Okay.
Very important. Keep routine. Don't let them fall out of routine, because it's very hard for patients who have Alzheimer's or other dementias. If they are not in routine, it will be more hard on them. So, for example, if you're serving the food, try to serve on the same table every day.
Okay.
Try to serve on the same time. Keep the pattern, the food, the utensils, everything kind of similar that you use in every day. Yes, very important, because there sometimes a lot of people, they're older, they have dementia, they're a little bit less steady. So try to keep the hallways clean where they're walking up and down. Don't keep the loose items on the floor, because they can fell down. They can trip and fall down, and that can cause a whole new problem. Like, God forbid, they can break their bone, right? Something. Of course, you need a room where they sleep, dim light or no light, less light, right? But hallways always keep it well lit at night.
Okay.
So when they wake up at night and they want to, kind of use bathroom, they don't. And familiar setting, don't keep changing their rooms or their setting where they live. Try to keep it consistent. Like, for example, if they're living ideally, they are on the downstairs, room, not going up and down the stairs. If they're on the downstairs, same room, same area of bed, the bathroom close by, no rug on the floor. The floor should not be slippery. If there's a carpet or something on the floor, that's fine, but it should be attached to the surface, not they can. So these all things will be helpful. Just like I mentioned earlier, don't reason, don't argue, don't confront.
Be patient.
Yeah, be patient. I understand it's hard and it's easier said than done, but it's a big problem. We have to deal with it. And if God give you opportunity, I guess we need to try to take care of that.
Yes.
On religious aspect of it, right?
Correct.
Because they took care of us when we were young, so
Yes.
now we are, it's time to give back, I guess.
Yes, and our culture is such, right, that we don't, the last resort is the nursing home, where we truly cannot take care of
if
them.
it's to the point and you feel like, their self-safety is compromised, then sure, that's totally fine. And a very important thing, because you are a human too, and sometimes they're going to say something that come out as a mean. Don't take it personally, because their brain is not really processing the information, how it's going to affect you, how their words going to impact you. So it's okay. Just don't take it personally. It's hard. It's hard. We have been trained all of our lives. When somebody says something, we have to say something back, and to tell them, oh no, that's how we feel. Yeah, sure. But in this case, please try to not, take it personally. If they say something, just try to move on.
Yeah. They are changing physically, mentally, emotionally.
Yeah. Because they're not really processing the whole information, how they're going to impact you. They're responsible for themselves, but they're not thinking how you feel about it.
Yes. Yeah, that is great advice, because, so many times all these things we tend to forget, and especially if, like, it's our parents. If one of our parent is going through dementia, we are so used to having our parent, in a certain way they talk or their actions, and then all of a sudden there's this change. We have to first accept it, accept the fact that, they have this disease, and everything has to change. Our perspective has to change completely.
Yeah. So, because we still have ability to change, our brain is still kind of processing that information, so that should be good enough. Like, if one person is not able to reason act strongly, we can have to, compromise on that. Not really compromise, more like it's courtesy to be nice to them and, be. So that are the few tips, basically from the person who is caregiving.
Yes. Now we reverse it.
Yes.
Advice on ways to manage caregiver stress.
That's even more important. Yeah, so on your end, because you are basically, ideally, it's not a one-person job. If you're caring for somebody who has dementia, and the person who is caring, it's not a one-person job.
Yeah.
Ideally, in ideal world, unless you don't have any other option, I will highly recommend to take a regular time off, even like 1 hour a day, even 30 minutes a day, self-care time. Just get out of that environment. Try to, do whatever you like. If you just like to get out, get something to eat you like, just go get it. You like to walk 30 minutes, sure, go ahead and get out of that environment. Give yourself a break. It's very important, because if you are in that environment 24/7, you are going to have a caregiver burnout. it's a very real thing. A lot of people who have patients with the dementia, or even like young mothers who have kids with the autism or some mental health issues going on, they're basically stuck with her or him or whatever 24/7, and they can impact their mental health really bad. So take a break. That's number one option, right? Take sleep regularly. Sometimes they wake up at night, sometimes they're in the morning. It's very hard, but at least keep 7 to 8 hours sleep schedule. Make it happen. Okay. Because if you don't work on that, you're eventually going to end up yourself in that certain position, right?
Right.
So nutritional meal. Try to eat healthy, big nutrition, because you're going to spend a lot of physical and mental energy on the patient, right? Call loved ones. I mean, if you have somebody around, in the city or out of country, so your emotion can also, can be processed. Talk to them. Call them and tell them how you feel about it. It's like a therapy, right?
Yes.
See a psychiatrist if you feel like you're anxious, you're getting depressed.
Yeah.
I don't think so. This is today's topic, but if you see any symptom of yourself, like insomnia, feeling empty, feeling hopeless, crying, more emotional, they're all symptoms of depression, right? So you should see yourself somebody. If not psychiatrist, see psychologist. Talk to them, have therapy sessions, once in a week or something, just to vent out your negativity that you're building up, so you can keep caring for them, right?
Okay.
These are all things. Happy. Go for yoga, meditation. I know you don't have enough time, but just try to do it a little bit, squeeze it in, right? And go for meditation. Meditation helps with anxiety, insomnia, depression. A lot of time people in Asia, they do meditation, especially in India, right? The yoga,
Yes.
And prayer does help. If you are if you are Muslim, just get time off and get some prayer time. So anything will be help in that sense. Okay,
That's wonderful. Yeah. And we also want to cover some legal aspects, of course, which, I didn't even think about that until you had mentioned it. So let's cover that as well.
Yeah. So legal aspect is very important. So basically now we have a, parent who was independent and they were making decisions all their life. When they have dementia or some other mental health issues, they cannot independently make decisions. Like, for example, we talk about decision about estate or, property or like anything, basically, giving consent for treatment to a doctor. So in that case, it's, very important for caregivers to talk to your parents before they have to that point where they cannot make decisions. Ask them what they want,
Okay.
right? Ask their opinion. Like, for example, people have different opinion on resuscitations, or like when, God forbid, somebody end up in cardiac arrest, what they want. So you need to know them beforehand.
Yeah.
You need to discuss that. It's a hard topic because the person may not willing to give you that answer because they go, why I will give you that answer, right? But you have to talk to them and talk to your loved one and feel like, ask them what they would have done. Like, if my dad was, in full mind, proper decision-making power, but he would have done it. Ask your, brother, sister, sibling, mother, anybody who can help you in that decisions. These things need to be taken care before the patient has, a dementia to the point. But if it's already happened, you are already crossed that boundary and you are not able to get that information, you can always go to the court, get a, guardianship, or get a power of attorney. And that's also with the, help of family. So you can have that power to act on his behalf, and wherever it need to be, as a daughter or as a son or as a, wife, so you can act on their behalf. So that's very, very important, and that's a very misunderstood in our community.
Yes.
Because we don't even talk about, that legal aspect, because once the person is, eventually, everybody has to die, right? And after that, there are a lot of things that need to be taken care. How are we going to take care of them if person is not able to, make those decisions? So these are very important, and we need to work on them as a community and help everybody. Very important. Ask them their wishes about how they're gonna, distribute their wealth if they have any assets, after the death. So how they're gonna do the funeral? They want to be buried in this country, or they want to send it back. so these are all things need to be talked about.
Yeah. It's good to have a will.
Yeah, it's always good to have it. Yeah.
Yes.
Yeah.
Yes.
It doesn't matter how old you are. It because nobody knows, right?
Right.
Life happens.
Right. That is true. Yeah, I know. I always say when I'm going to make sure I have my will, I have everything.
I say that too.
Have my funeral arrangements, everything done. So less stress for everybody else.
Yes, make it
our
easy for
family members. Yeah, I know. Like you said, in our culture, people get very offended, right? Our parents or even the older generation, they're like, "You want me to die?"
Yeah.
It's like no,
we don't want it, but we want it peaceful for everybody else.
Absolutely,
and for them too, because if their wishes were granted, that's what they want. That's also good for them and for everybody else.
Yes.
And we have less resentments after that, right? All the legal aspect becomes in the families, they will be less likely.
Yeah, that's so true. So, Doctor, any concluding thoughts before we wrap up?
Yeah, the concluding thought is it's pretty similar, that it's just any other disease. Be open to it, be mindful of it, get help, ask your doctor, ask your provider, help your loved one, and help yourself as well. So it's a hard process. It's not easy. Just like I earlier said, easier said than done. But we humans are very adaptable. We are very resilient, and we have ability to make things happen. And that's one of those things. We have to work on them and make it more comfortable for everybody else, and the life quality will be better. And just like I said earlier again, it's about quality, not quantity. The better quality, that's all everything it is.
Wonderful. Such a great way to end. Thank you so much, Doctor, for spending this hour with us here on Chai Time. It was really nice to have you and get to understand what really dementia is, how to handle it when someone does have dementia. So I really, appreciate your time with us here this morning. Thank you.
I'm very grateful to be here. Thank you for having me, and I'm looking forward to come again.
Yes. We definitely will. I have your number now.
Okay, perfect. Thank you.
Thank you. Thank you, listeners, for tuning in to Chai Time. We shall see you next week, same time, same place. Signing off, Chai Time, 103.5 Hum FM.